Today we are going to discuss how to access the items in the crash cart and navigate through the crash cart during an emergency situation. First, what you do is you lift the red lever, which will break off the green lock. After that, you push in, and that will give you access to the medication drawer at the top and the backboard here in the front, which is used for CPR. Then I'm going to start with the first drawer. You have different types of syringes, different mills. You have lab supplies. You'll have IV material, tape, IV tubing, pressure bags, and stopcocks. Drawer number 2 will have an introducer kit. You'll have sterile gown, towels, betadine, and a sterile marker. Drawer 3, you have a pneumothorax kit, sterile gloves of all sizes. You have supplies for an NG tube placement, 4x4 gauze, and Kelly clamps. Drawer number 4 will be primarily your respiratory drawer. You will have ET tubes of different sizes, intubation gear, your end-tidal CO2, your rescue pod, and nasal cannula. You may also find different modes for oxygen for your patient as well. At the very bottom is an open drawer where you will find a Centraline kit, an ambu bag, flashlight, and a suction regulator. You will also find your PPE supplies. Now I'm going to discuss what items are in the side drawers. The first drawer is liter bags of normal saline. You have multiple bags in here. The second drawer, you will have 250 and 500 ml bags of normal saline. The third drawer, at the bottom, you will have 250 ml bags of dextrose 5%, which you can use to mix your Levophed during the emergency situation. On top of the crash cart, you have a box of gloves. You do have some masks right behind it. You have multiple packs of hands-free defibrillator pads. You have EKG leads. You also have right behind that your suction canister and tubing, and you also have your oxygen tank.